I'm going to be performing the Varus and Valgus tests for MCL and the LCL. So I'm going to have my patient lying supine on the table, and I'm going to be on the side that we are going to be testing. First, I'm going to do the Valgus test, which is testing for the MCL. So what I'm going to do is I'm going to have her leg here, and I'm going to use my hip to stabilize this proximal part of her leg to free up this hand so I can palpate the joint line. My distal hand is going to grab her around the distal tibia, just proximal to the malleoli. And what I'm going to do is I'm going to pull a direction backwards, putting that valgus force this way, stressing that MCL. And I'm going to feel right over the joint line. And it would be a positive test if it opens and there's an open, empty end feel. And so it will kind of feel like it opens like a book. If that is going to be a positive test, which means that there's an MCL tear. Now I'm going to do the Varus test, so I'm going to go on the other side. I'll have her scoot to the edge of the table, and I'm just going to get on the inside here. I'm going to do the exact same thing. I'm going to stabilize with my hip on the proximal leg, stabilize her with the distal leg, palpate that lateral side of the joint line, and do a force towards me, giving a Varus force, palpating that lateral joint line there, feeling if there's any open end feel. And if I did feel an open end feel, it would be an LCL tear. And then both for Varus and Valgus, you're going to want to test them straight in 0 degrees of extension and in 30 degrees of flexion. And so in that 30 degrees of flexion, you will feel them open a little bit more, but you will want to do them in both positions and compare to both sides.